As a healthcare provider, speaking to a patient in their native language makes intuitive sense. But is creating additional sets of professional recordings worth the time and the effort? Let's get into it. Now, in my last video, I talked about the importance of building a multi-language voice interface for your phone trees and call center systems. Today, I'd like to talk about healthcare services and how speaking to callers in their native language improves patient care. In my home state, according to the Massachusetts Commission on the Status of Women, around 1 in 10 residents are limited in their English-speaking ability. And in our work with hospitals and medical centers, we've found that this is a problem in many other states as well. They talk about inequities that underserved communities feel, in part due to the communication barriers in trying to get critical patient care information across. Members of these communities often feel comfortable conversing by phone, but hospitals and medical centers struggle with this. So let's talk about the patient-caller experience. To get off to a strong start, the patient should be greeted in their native language. Hearing a familiar language delivered by an authentic and empathetic native speaker will immediately put the patient at ease and ensure that important information or instructions are clearly understood. Beyond the greeting, there are 3 important patient care categories that require clear and common communications. Number 1, hospital visitation instructions. What does a patient need to know to have a successful visit? Well, they need to know where your facility is, how to get there, how far in advance they should arrive, and how to prepare. On this last point, the patient may need to arrive with certain paperwork filled out. They may need to know fasting requirements for lab tests or to bring certain items for a hospital visit. Now, in parts of our state, we have a large Brazilian Portuguese population. Imagine being a member of the group and having to digest this information if English is your second language. I have a hard enough time remembering all of this in English. Number 2, emergency and crisis services. Now imagine you're the same patient, except you're faced with a crisis requiring emergency or specialty health care. It may involve sexual assault, domestic violence, or an emergency medical event. The phone is highly likely to be the first avenue the patient chooses if they need information quickly, or if the call is in response to a sensitive situation. Again, it's about ensuring the information is understood, but it's also hearing an authentic and familiar voice on the other end of the line. Number 3, healthcare insurance. Healthcare insurance and billing questions are critical. They're often stressors for underserved communities. Now, a phone system can handle the communication of simple but important information like when co-payments are due, options for how payments can be made, which phone numbers you should call in different situations. For advanced IVR systems in which caller-specific information is provided, like balance due and due date, it's particularly important that the caller understands all of the information and that language barriers aren't an impediment. There are 2 basic options for conveying patient care information through pre-recorded phone system messages. The information can be spoken after the initial phone greeting in an auto-attendant system, usually by pressing or saying a number on the keypad. So for example, press 2 to hear our hours and location. The other option is to play this information when the patient is on hold. Actually, there are other ways. You could impart this information through a video or even a podcast. Of course, we stand ready to professionally record any messages you need. We record in 88 languages and dialects, and we can also provide you with certified translation services if required. We've worked with over 450 healthcare companies nationwide. So whether or not you have an active voice project planned, I'm happy to talk informally to trade ideas about how to use native language voice recordings to improve patient care. Feel free to reach out to me at any time. Thanks.